Hello and welcome to another episode of the SITREP. If you are a veteran who plans on traveling out of the country, you may be surprised to know that the Department of Veterans Affairs has a foreign medical program to support you while you are abroad. But before we dive into the details, do us a favor and hit that like button and subscribe, which helps the SITREP in its mission of connecting veterans with the benefits they have earned and deserve. Also, before we get started, we've had a lot of people email us asking us to provide the option to watch full, complete podcasts of the SITREP. So from here on out, we will provide that option on all podcasts, and you can find the links in the video description below. So for today's first part of the podcast on the foreign medical program, we are joined by none other than Leticia Diaz. Thank you so much for being here, Leticia.
Good morning. Thank you so much for having me here today.
So, Leticia, a foreign medical program, I'm sure there's a lot of veterans out there, just people in general, like, what is that? So if you could, for the audience, what is VA's foreign medical program?
The VA foreign medical program is a reimbursement program for veterans who are living or traveling abroad. And
so it's not necessarily that, like, the VA has their own clinics that are out there or hospitals that are out there, but it's a way for veterans to be recompensed for treatment that they're receiving outside of the United States.
Yes, sir. So it has to be service-connected treatment.
Okay, can't be just anything.
No, sir, it cannot. So the veteran has to be service-connected, so VBA rated, and the percentage could be from 0 to 100, but they must be service-connected, or it has to be an aggravating, it has to be anything aggravating their service-connected condition.
Okay, and what if I happen to be a veteran who has disability from VBA, but I'm not enrolled in the VA healthcare system? Am I able to use this, or do I have to already be enrolled?
You don't have to already be enrolled. You can send your FMP registration form with any supporting documents as far as like a bill or, for us to process a claim.
So what types of medical services are provided through the foreign medical program in the VA?
So any healthcare service, as far as outpatient, inpatient, durable medical, some dental, pharmacy, all those services are provided.
But
are paid for, I'm sorry.
Okay. But like you said before, it has to be related to a condition, illness, disease, whatever, that the veteran is currently rated for.
Yes, to a service-connected condition.
So, Leticia, I'm out traveling with my family abroad, and my daughter or my wife gets hurt. Are they able to use the foreign medical program, or are they?
The foreign medical program is strictly for veterans only.
Okay, so no children, no spouses, no none of that kind of stuff. What if they happen to be in CHAMP VA?
Well, then that would be a CHAMP VA foreign. So I would, you would be directed to CVAF.
I didn't even know they had a foreign program.
Yes.
Wow.
For the spouse and children.
I wonder if I asked them that question during my podcast. I don't know. I don't think. So, Leticia, if I'm a veteran in the audience right now, and I'm like, hey, I'm going to Australia, or I'm moving to the Philippines, or I'm just going on a trip backpacking through France or something. And I want to make sure that, I can get the care that I need or what have you. How is it that a veteran gets enrolled into or becomes a part of the FMP program, the foreign medical program? Or do I just send you a bill? How does that work?
Our veteran would need to complete a foreign medical program registration form, and you can submit that by mail, by email as well. You can fax it, and you can send the request through Ask VA. So,
Leticia, are there places in the world where if I'm a veteran and I need medical service, like using the foreign medical program through the VA is just, it's a no-go?
Any U.S. territories, North Korea, Cuba, and Iran.
Why the U.S. territory? Oh, because we have clinics and stuff there.
Yes,
so
we only covered for and our veterans who are living abroad or are traveling abroad as well.
Okay. So, Leticia, if I'm a veteran that's traveling, I'm in the Philippines having the time of my life, and oh shoot, I dropped my medication in the sink and it's all gone. Can I use the FMP program in order to get meds that I really, really need outside of the country?
Yes, you can. The medication has to be FDA approved, and it has to be a medication associated to your service-connected conditions.
Okay. And how do I get recompensed for it?
So if the veteran pays, they would have to submit the VA form, our claim form, and by doing that, they would select, if they made the payment, pay the veteran, and they would need to send in the receipt as well.
Okay.
To show proof of payment so we can reimburse the veteran.
So I'm kind of curious, if I'm a veteran who has like an ongoing condition, and I'm like, I guess this would be more for a veteran who's actually living abroad as opposed to, I mean, if I just went somewhere on vacation, I'm eventually going to go back home. But if I have an ongoing condition, is this something that the federal medical program will take care of forever, or is it like, is there a cap to it, or how does that work?
If it's an associated service condition, then the foreign medical program would cover.
So for veterans that are out there and maybe they end up with a mental health crisis, or they just have a ongoing mental health condition while living abroad, is mental health something that the foreign medical program will take care of?
Yes, we do. The foreign medical program does cover for mental health as long as the veteran is service connected to it.
I'm curious, if I'm a veteran that's out there and I'm in Germany, whatever, and I'm like, ooh, I need to get this taken care of. I think it's related to my disability in one way or another, but I'm kind of like guessing. Is there a way for me to contact the foreign medical program, VA's foreign medical program, and get like a predetermination?
Yes, the veteran can submit a predetermination letter to the foreign medical program. We will then review if we're still unsure if it should be paid or denied. Then we will direct that to the clinical review nurses. They will review it and they would let us know, if it would be payable or we would deny.
For a veteran that is thinking about utilizing services or benefits through the foreign medical program, through the Department of Veterans Affairs, how do they go about doing that? Like, what does the process look like? And I don't know, how long can a veteran expect for the process to take?
So currently our goal is to process submissions within 45 days. But at the time, we are processing within 120 days out.
Okay. And is there a way for a veteran to expedite the process, or for the foreign medical program itself to expedite a process? Because I can imagine some of these situations are very urgent.
Yes. Yes, we do have a foreign medical program, our specialty escalations team. And what they do is they do process urgent CRM issues, which is when the veteran calls in and they do have, like an urgent issue that needs to be taken care of, a bill or, a possible collection. And they would send the request over to Ask VA, and they will work on completing that. But, it has to be deemed urgent, I should say. And any congressionals, White House inquiries as well, the escalation teams takes care of that.
If I'm a veteran who has submitted a claim through the foreign medical program and it's been denied, is there like an appeal process, or is there someone like a higher level review that I can request or something like that?
Yes, there is an appeal process.
And how does that work?
The veteran has up to a year to submit that appeal. Once you mail it in, we will direct it to the appeals department, where they then will review it. But if any claim is denied, you will receive an EOB.
And what is that?
The EOB will let you know what the denial was for, and it gives you a description of it as well.
And link to all that stuff will be in the video description below.
Hey folks, connecting with your benefits is our primary mission, and the SITREP is providing more options than ever.
Subscribe to our free email newsletter, subscribe to our audio podcast channel, or subscribe to our content on YouTube.
For details and links, check out the description below.